It's another Hello Healthy, a Dignity Health podcast with Bill Klaproth.
Stroke is the fifth leading cause of death in the United States and the leading cause of disability. So what do you need to know about early detection and treatment through endovascular thrombectomy, or EVT? Here to talk with us about thrombectomy and the Stroke Center at Memorial Hospital is Dr. Kiron Thomas, Director, Stroke and Neurointerventional Services at Dignity Health, Bakersfield Memorial Hospital. Dr. Thomas, thank you so much for your time. So what are the two different types of strokes we should know about?
Good morning, Bill. Thanks for having me here. So the stroke means injury to the brain, or more or less irreversible injury to the brain because of a blood vessel-related problem. So that is what the term means. And there are two types of injuries that can arise from vascular problems. One is ischemic, meaning there's a blocked blood vessel, or the second is the hemorrhagic, where there's a leaky blood vessel. So it is essentially a dry problem, meaning injury to the brain because there's not enough blood getting there, or hemorrhagic, a wet problem where there's a puddle of blood that's leaked out from a blood vessel, causing injury to the brain just because of the pressure or the mass effect of the hematoma or the blood puddle. And also, this blood was supposed to reach somewhere, which it did not, so you can have injury arising from that too. So ischemic and hemorrhagic stroke, to answer your question, these are the two types of stroke that we come across.
And with ischemic stroke, those are largely treatable, is that correct?
Now, the term stroke itself means there's irreversible injury. So when injury to the brain occurs, it's essentially considered irreversible. There is no going back on that. However, during the during the evolving phase of the injury, there may be steps that we can take to either halt the progression of the injury or maybe even reverse some of the effects by restoring the blood flow, or if it's an ischemic type of stroke, or stopping the hemorrhage or the potential for further hemorrhage if it's a hemorrhagic kind. So to answer your question, yes, despite the term meaning irreversible injury, during the hyperacute phase or the acute phase, the first few hours of the process, there may be steps we can take to reverse the problem or limit the problem.
So it's important to get the patient to the right hospital for the right treatment. Is that correct?
Absolutely. So many of the advancements in treatment of ischemic stroke, for one, even hemorrhagic stroke, it is the advancements that have been made, in the last 10 or 15 years. Some of those advancements are still not available in many of the centers in the country. So in ischemic stroke, on the other hand, most of the advancements have been made in the last 4 or 5 years, the path-breaking advancements. So it is very important to identify stroke, for one, to make sure that we get the patient to the right place and in the right time, and two, the right place is very important because many of these the capabilities, many of these advancements are pretty sophisticated, and it may not be available across the town that you're living. There may be only one center in town that has it, or sometimes it may not be even available in town. You may have to be airlifted or transported to a different city to have this done at. So identification of the place to go to when you have symptoms of an ischemic stroke or hemorrhagic stroke, for that matter, it's very crucial.
And you just mentioned advancements. Can you tell us about advancements in early detection and treatment of large ischemic strokes and how that's improving patient outcomes?
Sure. So the two key words that you used, large and ischemic. Ischemic means there's a lack of blood flow, and large, it's a larger territory of the brain involved as opposed to a small region. And how is that relevant? Because, the brain is not just supplied by one vessel. There are 4 major vessels supplying the brain, and also it is not those 4 vessels, it's the numerous branches, small branches that arise of it. So the smaller the vessel involved, the smaller territory of brain that will be affected. On the other hand, if it's a larger vessel that goes up, to one side of the brain and gets blocked before it branches out, then, obviously going to be a larger area of the brain that's going to be affected, and thereby a larger deficit that the patient will be left with. In larger vessel strokes, because, the stakes are really high because it's a much bigger territory of brain that's involved here, it is important that we do everything possible to try to limit the progression of the injury or reverse it. And how do we do that? A large vessel stroke is caused by obstruction or occlusion of a large blood vessel. And we can try the clot-dissolving medicine just as we used in the small strokes. We can use the same one if the patient is a candidate. So there are time limits or, patient characteristic limit, criteria that applies here. We can try that medication, but many a time we know that, large vessel strokes, the chances of that clot-dissolving medicine is medicine working and opening up that vessel is not that high, right? So there is still a great proportion, a great number of people who may not derive, complete or good benefit from that clot-dissolving medicine. So in those cases, it may be reasonable if for the right patient, with the right characteristics and the right time frame, if we can go up and somehow mechanically open that vessel, either sucking the clot out or dissolving by injecting medication directly to it, or using devices called stent retrievers to, pull the clot out. If we can open up that vessel, we can limit the actual, amount of injury that otherwise would have happened. And that would make a huge difference. That would determine whether the patient is going to be independent or completely dependent for the rest of his life.
Well, that's really good to know, Dr. Thomas. And can you tell us about the endovascular thrombectomy? What is that, and what kind of stroke needs a thrombectomy?
So endovascular pertains to the inside of a blood vessel. So what it means that we are actually, going through the blood vessel. The most common site of entry is in the groin. We get into the blood vessel with a series of tubes, slender hollow tubes called catheters. We navigate through the blood vessel using, fluoroscopy or X-rays to get to the point of occlusion. And we deliver, devices called stent retrievers or use suction or use medication to open that vessel up, either by pulling the clot out or maybe disintegrating or dissolving the clot with medication. So that procedure of opening up a vessel, which was previously occluded by a blood clot, is called thrombectomy. Thrombus refers to clot, and thrombectomy means removal of that blood clot. So it is very important to see if the patient would be a candidate, would meet the criteria for thrombectomy in a large vessel occlusive disease or large vessel occlusion.
And Dr. Thomas, I just quickly want to ask you, what are the symptoms of both ischemic and hemorrhagic stroke?
So again, the symptoms of a stroke, whether it's hemorrhagic or ischemic, are all related to the area of the brain that's involved. Okay, and the only additional symptoms that you can expect with hemorrhagic stroke is symptoms related to increased pressure inside the skull. And those symptoms are, depressed consciousness or headaches, someone who all of a sudden becomes very drowsy and lethargic or has a massive headache. These are symptoms of a hemorrhage in addition to those symptoms related to, dysfunction of that part of the brain. The most common symptoms, which are most, easily noticed, are what is described by the acronym FAST. So facial asymmetry, because there's weakness of the facial muscles. And loss of strength in the arms, and speech, because your speech is either slurred because of, loss of motor tone of the facial muscles or tongue, or an impairment of language. So the ability to understand and produce language or spoken language or written language. So these are the most commonly, and easily noticed symptoms in acute stroke. Doesn't mean that these need to be the only symptoms. Sometimes strokes can be pretty hard to diagnose, even or discern, even for a neurologist. So some of these strokes, depending on the area of the brain that's involved, you can have different symptoms, but the face, arm, and speech are the most common and easily noticed ones.
Okay, very good to know. And Memorial Hospital has achieved national recognition for excellence in stroke care. What standards must the hospital meet to achieve this certification?
That is true. So Memorial was recently designated as a thrombectomy center, a thrombectomy-capable center by the Joint Commission. And what that means is, or any certification means that, we have standardized care. So it is not a one-off thing for one patient who's lucky enough to get the procedure. We standardize the availability of the procedure, availability of the facility, and the way we do this so that we can optimize outcomes for the best, to aim for the best outcome for every one of the patients who come to the ER or being transferred to that hospital for any reason. Every patient that comes to the hospital will be met with and will receive the same standard of care, which is comparable, which is at par with anything that you can receive from any advanced centers in the country.
And how is the Sarvanan Heart and Brain Center at Memorial Hospital uniquely qualified for this distinction?
So, just like what I mentioned before, the certification entails a lot of things. So making sure that, okay, we adhere to all the protocols, all the guidelines that's been enunciated by the certifying bodies or the boards that govern or that research the problem. And so that is one thing. So, for example, how long do we take to get a CAT scan? How long do we take to get a blood draw after the patient hits the ER door or comes to the facility? But it's important that we try to shave off every minute possible in trying to get the patient to the right treatment, whether it's the clot dissolving medication called alteplase or a life-saving or quality of life-saving altering procedure like thrombectomy. So one thing, the most important thing about certification and what's unique about the Saravanan Heart and Brain Center is that we constantly strive to meet those guidelines, to meet with the parameters that've been enunciated by the body, or even try to better them whenever possible. And the second is the facility. So we have a biplane unit, which is the gold standard for imaging in neurovascular procedures. And we have a neurological critical care unit that is dedicated to care of patients with very critical conditions involving the brain and the spine. So all these, factor into the ultimate outcome that the patient will experience or will have when they are, when they suffer, when they experience the life changing condition like a neurological problem.
Well, Dr. Thomas, this has been very informative, and thank you for your time. For more information, please visit dignityhealth.org/Bakersfield. That's dignityhealth.org/Bakersfield. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.